Today, today I received a pretty solemn phone call. This poor business owner rang me and said, Max, I've got nothing left. A staff member's just called me and saying they want 100% of their pay. I haven't been doing that. And they said that I've got to do it. And I've heard you mentioning that I had to pay full times. Max, I've even gone right through my Visa card. I have nothing left. My family, I'm too scared to even look at my children. I hold my head in shame because I can't even keep for them. I can't keep them anymore. The next place for me to go to is to Wins and beg for money. I'd sell my car, but we won't even be able to take our kids to school when we need to. I've got nothing left, Max, nothing. What am I to do? What am I going to do with my staff? They'll just sack them. They'll sue me. Max, I just don't know what to do. I've got nothing left and I'm broken, absolutely broken.
Whoa, Max. Well, I guess, Max, you've just improvised what tens of thousands of small business owners could be doing right now. Backs to the wall. No tomorrow, no prayer that's going to save their business. And, I guess the situation that we're in, Max, is mental health is a very blanket term, and not the least in the small business sector right now. It's a community of 530,000 small businesses, 600,000 employees, about 800,000 in total. And every day we are now seeing and hearing a broader acknowledgement and general consensus that mental health is a real issue in the small business sector. And the government and those working with close to it will have a working knowledge of that it's impossible to fulfill a health-based response, a risk-based COVID response without unintentionally destroying small businesses, because most small businesses are not viable.
That's real. That's real people's lives. This is
real people's lives.
That guy told me that it's children he's worried about, and he's got nothing left, and I can't provide for them. He is broken, absolutely broken by no fault of his own. Jesus, mate, I was touched.
Max, it's glum stuff. And, when you're eliminating a virus, this is government-wise, you can't have your cake and eat it too. Some small businesses are simply collateral damage. And when a government is committed to eliminating that virus, failure is imminent for some businesses. Look, from a business advisory perspective, every day, I'm having discussions where you're actually talking about an exit strategy. How do you get out of this mess without it being any more messy than it already is? And the difficulty you've got there is getting people to separate the failure of the business from taking that on board as failure of themselves. It's not easy to do. And, as I've said, very few small businesses cannot get through a level 3 or 4 without absolutely being smashed both financially and mentally. This is a real big issue that's on our plate. And I guess that, the ailing issue that's within the small business community, it's a big storm heading our way. The clouds are building on the horizon, but it's about to hit like a tsunami. And talk, of any of the organizations with big small business databases, your MYOBs, your Xeros, the major banks, that have got sort of a footprint over about 80% of the New Zealand small business community, their surveys and research will tell them that over 30% are reporting of those small businesses mental health issues. So we're talking around 250,000, people that have actually got issues in a mental health capacity.
What compounds this, Vaughan, is not only they suffering financially, they're suffering mentally, but they're sitting at home unable to, this is Auckland people at least, unable to do anything about it. And all they're getting from their bank is, there's no more. There's no more. You've stopped. Yep. You've done your visas. You've done your credit cards. You've done your loans. You've got no more. And look, it's just heartbreaking for these guys. And what's hanging off the back of them is families, not their own family, but their staff families as well. This is real people. And what did you say? 30% of them.
30%. So we're talking about 240,000 people right now in the small business community would be looking or requiring health support in terms of mental health. Now, to put that into context, if the government was to, in terms of a health-based response, support the small business sector with, let's say they paid psychologists to provide, there's not enough psychologists to do this, by the way, so it'd have to be counsellors, 10 sessions for each person, 240,000, 10 sessions, $250 a pop to get a psychologist. That's $600 million, right?
Wow.
That's just financial, and that's no outcomes at the end that everyone's going to be all fine and dandy, right? So we're talking a massive, massive number. This is not tiddlywinks. And actually, Max, on that note, I've got to add, I noted with interest that Business New Zealand, our good friend Kirk Hope and the National Party jointly lobbied the government to urgently set up a $10 million fund for the small business community to access mental health support. While it's a noble and well-intentioned idea, it holds no water in my mind for two distinct reasons. Reason one is that the problem with a suggested 10 million support package via the Business New Zealand database and footprint only represents 60,000 small businesses, so less than 11% of the small business sector has any space. So the primary issue there is the benefactors of that 10 million would be Business NZ, EMA, and chamber members. Everyone else misses out, the other 98% of the community.
And I'm hoping the politicians are listening, because what I'd like to say, you've numbered 250,000 people are affected by this. So that's businesses. But look at the families and hang on to that. So you're talking 500,000, you're talking nearly 1.5 million people are touched by this. So don't underestimate the impact this is going to have on our whole society. And to do nothing and just go, well, that's business. They can look after themselves. It's not good.
That's right, Max. And on a bigger picture note, this is more than just, so I completely get where National Party, Business New Zealand talking are coming from. But outside, Business New Zealand has no interface with Māori sector, Pacifica, or wider than their members, the chambers. Therefore, the 10 million will be disproportionately distributed in favour of their members, and that is not targeted, that's manipulated. So to be frank, hard evidence of how detached the National Party currently are from the small business community too. You can't look at the small business sector through a Business New Zealand lens. It's only a part of the picture in terms of, secondly, and more importantly, what would you do with that 10 million? I mean, it's a drop in the bucket. What we're looking for is a bespoke program for the small business community. And so I doubt very much that 10 million would go very far.
I'll tell you what they do with it, Vaughan. They do what the health sector did when they injected, 1.5 billion. They immediately built a high-rise or a big flash building in Hamilton for their staff. I mean, that's for the executives of the health industry. Where's the money going to go to the real people, the people that are suffering? That's what we want to know. And as you say, Vaughan, that's a drop in the barrel what they're offering.
And hard out, Max, this is where I stand with mental health and the small business community. There's already support services in place that small businesses can reach out to right now. So in terms of the short term, whether it's Mind Labs, Clearhead, or whether it's a number of places you can go to, they're on government websites for mental health support. So that's the short term today, what you do. But, in terms of, we've talked many times about we need leadership and a central place for small business in New Zealand. There should be just one hotline every small business in New Zealand can ring, and within seconds they have been linked up with the appropriate resource that already exists within government. That does not exist.
Mental health support or whatever, financial support, whatever it might be that's available.
That's right, whatever. Yeah, so sort of like playing around with it via Business New Zealand or looking at someone else. It's using, advocacy groups or social do-gooders to do a massive job with the wrong tools. I just say to the government, keep your money in this instance and let's have a look at it. So once again, Max, I'll put it into context. Mental health is a blanket term. Mental health in the small business sector has its nuances, and unless you're in the trenches and you really understand what it's like to have a bank personal guarantee over your head, a landlord, creditors on the phone chasing you for money, you have no friggin' right to be taking a position of authority on this. And so, small business needs a mental health evangelist, a face with gravitas, a face where you can smell the sweat. John Kerwin is the evangelist of depression. Mike King, the evangelist of youth suicide. It needs to be someone who's been on the other side of the wire in small business, who can speak based on relevant experience, not a pin-up poster boy or girl chasing the New Zealander of the Year of award. That's kind of like, let's move on from there. It's way bigger than this. So I guess I've got to close with, don't let the health of your struggling small business be a mirror image of your own health. You can separate them. And that's, what I'd love to, anyone ring me if you want help how to do that. Been there, done that, know how to do it. It ain't easy, but it can be done. Lockdowns level 3 and 4 will take out small businesses. No question that even the best of entrepreneurs could not done anything about this. So, my closing line is, Max, rise above it, know how to lose the battle, not the war.
Good one. Okay, Vaughan. See you tomorrow.
Thanks, bro.